WAYRILZ is approved for adults with persistent or chronic ITP who received a prior treatment that did not work well enough. I try to spend some time talking with my patients, seeing what symptoms of their disease are most bothersome to them, and seeing how their disease is limiting them from carrying out their everyday activities that are a priority. I want my patients to kind of understand how the treatment works and some of the pluses and the minuses of each particular treatment. But I think by having that conversation and understanding what my patient values, understanding if it's a treatment that needs to be administered once a week in the office and my patient lives 40 miles, 50 miles from my clinic, then that's not going to work for their lifestyle. So I think having these open dialogues are very important. At the same time, if I feel like there's a therapy that's right for my patients, I try to explain to them why I feel that's the best therapy for them and just kind of talk with them about, again, some of the pluses and minuses. I think just talking a lot about their main symptoms that have burdened them in association with their ITP, and also just kind of, everyday life. Are you working? Do you have children that you need to be, taking care of? What do you do for a living? Is this a job where, you may have risk of injury or impact? What platelet count do we need to kind of target for you? Some patients may be fine with a platelet count of 30,000. Other patients, depending on, what their job or their lifestyle is like, or other, procedures that may be upcoming, need a higher platelet count. So it really does, I think, become a really individualized approach to each of our patients with ITP. So I just think trying to explain why I'm choosing each therapy, really kind of, talking through patients' individual goals, talking about how ITP really is a disease where the immune system is really tipped out of balance. Trying to have patients have a good understanding of their underlying disease can be really helpful. I also want to make sure, again, that we're having open lines of communication. I want my patients to feel comfortable contacting me, contacting my office, and making sure that they have a smooth path to do so. I think it's really important that those lines of communication are in place. And then finally, what I do kind of share with my patients is that, none of these treatments are necessarily one-way doors. If we try a treatment and it's not working or patients aren't tolerating it, there are always other options. Starting on a drug like WAYRILZ doesn't preclude a patient from trying a different therapy for their ITP down the road if needed. I think it's so hard when patients are sitting kind of in my office. It's like you're in the hot seat, right? And everything that you wanted to talk about just sometimes flies right out of your mind, and you just sometimes feel a little bit blank. And I know some offices, including my own sometimes, it's overwhelming. It seems like you're being rushed. And so I really encourage for a lot of my patients to even just keep a little symptom diary where they just jot any possible side effects that they have that they perceive could be associated with their ITP treatment down, and also to, jot down any bleeding events, any easy bruising that they're seeing on that day, just really how ITP and their disease are interfering with their daily life, to talk about some fatigue levels, if there's something they weren't able to do on a particular day because of fatigue, to note any difficulty concentrating, any missed work, just to kind of jot this all down, and then to kind of try to take this and compile a list of top issues or top questions to be addressed during each of our appointments. I just want to make sure that I can really address patients' most, critical and important concerns. I really want to empower my patients to just understand, when we're looking at some of these numbers, what they mean, what our target is. And I think it's important, specific to our patients with ITP, we're not necessarily targeting that normal platelet count. It's important to understand what that normal range is, but, sometimes all we're targeting is a safe platelet count. I think every patient should understand it is absolutely your right to have your concerns heard and taken seriously. I think some of the techniques that we talked about, kind of journaling, making sure that, you understand and can, put forth your issues are very important, and to have that list of those priority issues when you're walking into your provider's office can really kind of help. That being said, if you really feel like your healthcare provider is being dismissive or is not listening to you, sometimes it's just not the right fit. ITP is not a common disease, it is a rare disease. And so if you really feel like you're not being heard by your provider, sometimes it might be time to just, seek a second opinion just to get a different set of ears and a different perspective.
Important safety information. What should I tell my healthcare provider before taking WAYRILZ? Tell your healthcare provider about all of your medical conditions, including if you have liver problems, have kidney problems, are pregnant, or plan to become pregnant. WAYRILZ may harm your unborn baby. If you are able to have a baby, your healthcare provider will do a pregnancy test before starting treatment with WAYRILZ. Females who are able to become pregnant should use an effective birth control during treatment with WAYRILZ, and for 1 week after the last dose, are breastfeeding or plan to breastfeed. Do not breastfeed during treatment with WAYRILZ, and for at least 1 week after the last dose. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Taking WAYRILZ with certain other medicines may affect how WAYRILZ works and can cause side effects. WAYRILZ may also affect how other medicines work. What should I avoid while taking WAYRILZ? You should avoid grapefruit, starfruit, and products that have these fruits, and Seville oranges, often used in marmalades, during treatment with WAYRILZ. These products may increase the amount of WAYRILZ in your blood, which increases the risk of side effects of WAYRILZ. What are the possible side effects of WAYRILZ? WAYRILZ may cause serious side effects, including serious infections. WAYRILZ can increase the risk of infections, including serious infections that can lead to death. Your healthcare provider will check you for signs and symptoms of infection during your treatment with WAYRILZ. Tell your healthcare provider right away if you get any signs or symptoms of infection, including fever, chills, or flu-like symptoms. Liver problems, including drug-induced liver injury, DILI. Liver problems, which may be severe, life-threatening, or lead to death, have happened in people treated with Bruton's tyrosine kinase, BTK inhibitors. Your healthcare provider will do blood tests to check your liver before and as necessary during treatment with WAYRILZ. Tell your healthcare provider right away if you have any signs or symptoms of liver problems, including stomach area, abdominal pain or discomfort, dark or tea-colored urine, or yellowing of the skin or the white part of your eyes. The most common side effects of WAYRILZ include diarrhea, nausea, headache, stomach area, abdominal pain, and COVID-19. These are not all of the possible side effects of WAYRILZ. What is WAYRILZ? WAYRILZ is a prescription medicine that is used to treat adults with persistent or chronic immune thrombocytopenia, ITP, who received a prior treatment that did not work well enough. It is not known if WAYRILZ is safe and effective in children. Please see accompanying full prescribing information, including patient information.